The Missouri Attorney General institutes emergency rules which would make it much more challenging for transgender students and even adults to access puberty blockers, hormone treatments, or gender transition surgery. AG Andrew Bailey calls certain gender-affirming medical procedures experimental. He argues that the surgeries need substantial guardrails. The new rules mandate anyone receiving puberty blockers, cross-sex hormones, or gender transition surgery receive 15 hourly sessions with a psychologist or psychiatrist over at least 18 months. They also bar physicians from prescribing puberty blockers or cross-sex hormones unless a patient has 3 consecutive years of medical documentation showing gender dysphoria. This is one of the first times we've heard this approach. We wanted to welcome in Missouri Attorney General Andrew Bailey himself, and we can talk more about this plan. AG, welcome, and thanks for coming on. I sort of laid out the basics of it, if you could, but could you go on to describe why you believe this emergency rule, which is set to go into effect on April 27th, is so important right now?
Well, this is about protecting patients, and the science backs up that there are 0 FDA approvals or clinical trials supporting the notion that puberty blockers and cross-sex hormones are safe for treatment of gender dysphoria. And if that's true for kids, it's also true for adults. Why does the left not want there to be safeguards in place to protect parents? And more importantly, how did these quote-unquote healthcare clinics ever obtain medical malpractice insurance without doing these basic common sense safeguards? I mean, all we're asking for here is that there be an assessment to determine what mental health conditions exist, that there be access to mental health treatment, that we obtain and retain real parental consent for the kids, and we track adverse outcomes. That is common sense patient protection. And so I'm amazed that the left wants to vilify me for trying to protect patients.
Just to be clear, is this an effort from your office, or is the state legislature also involved?
Well, my office has promulgated an emergency rule under my authority in statute, but I'm encouraged by the work that the Missouri General Assembly is doing as well to also codify more permanent protections.
As you pointed out, it's being met with controversy, no doubt about it. Like we said, this is really one of the first in the nation, especially when it comes to that adult angle. So we've heard from the ACLU and Lambda Legal. They released a joint statement. I want to share this with our viewers. They said, quote, "Take any necessary legal action against you. The Attorney General's so-called emergency rule is based on distorted, misleading, and debunked claims and ignores the overwhelming body of scientific and medical evidence supporting this care." AG, your response and your thoughts on the possible legal challenges?
Well, these clinics are a bloody scourge intended to defile innocence, and we're not going to stand for it. We're not going to let left-wing quackery experiment on kids or any other patient in the state of Missouri. And the left clearly hates me more than they want to protect patients. And so we're going to fight the good fight. I'm proud to be leading the nation in this effort. And again, I'm encouraged by the work the Missouri General Assembly is doing. We're leading the way, and they're following behind, and we're going to get a bill in place, and we're going to protect patients here in Missouri.
It's not just the ACLU and this Lambda Legal Group, but also the Secretary of State, Jay Ashcroft. He spoke with the St. Louis Post-Dispatch. He basically said he wouldn't want to be the attorney that was defending it. If you're an adult, you have the capacity to make your own decision. It's a decision I would disagree with, but I don't believe it's the role of government to forbid it. So again, he seemed to support the sort of protections against children undergoing these gender surgeries here, but taking issue with the adult part about it. Why do you believe that you in your office should be able to dictate what adults do when it comes to their own health treatments?
Well, we're not controlling individual adults. We're protecting patients. These limitations are placed on providers. Providers should be required to provide mental health assessments, to obtain real consent, to acknowledge the experimental nature of these drugs. Why would anybody be against protecting patients? This isn't interfering with individual healthcare decisions. This is putting safeguards in place that limit providers' provision of care in such a way that makes sure it's safe.
All right. And we're going to wait and see what happens with it. Again, first in the nation, so it's interesting we're talking about it. We appreciate you coming on and sharing your perspective. Missouri AG Andrew Bailey, thank you.
Thank you for having me.
You're welcome.